Once again, welcome everyone to this OPM press conference. Secretary McCaw will be going through the PowerPoint deck. Remind everyone to please keep yourselves on mute during this, and also please keep your video off. Once the press conference concludes, I'll ask you to use the hand raise button, or if you're joining by phone, shoot me a text message, and we'll try our best to get through as many questions as we reasonably can, either of Secretary McCaw or of the commissioners who will be joining us to answer additional questions as well. So without further ado, we'll be getting started now. Secretary McCaw, go ahead.
Great. Good morning, and thank you very much for joining us today for an overview of Governor Ned Lamont's plan for the American Rescue Plan Act funds. The theme of the governor's vision is a roadmap for a transformative, equitable, and healthy recovery for our state. So first, just a quick overview of the bill that passed in Washington. Connecticut's share of the Coronavirus State Fiscal Recovery Fund is estimated at $2.6 billion. These funds are available for about 3.5 years through December 31st, 2024. We have not received official guidance from the U.S. Department of Treasury pertaining to the use of these funds. However, based on the bill language, we are aware that the allowable uses include expenses associated with responding to the COVID-19 public health emergency or its negative impacts, economic impacts thereof, whether that's a household, small businesses, nonprofits, or impacted industries such as tourism, travel, and hospitality, to support workers performing essential functions during the pandemic through premium pay, for example, and also for the provision of government services to the extent that there is a reduction in revenue that was experienced by the state. The language also allows investments in water, sewer, or broadband infrastructure. Based on the language that passed, there is explicit language that will not allow the funds to be used for deposits into any pension funds or to directly or indirectly offset a reduction in tax revenue resulting from a change in law. The language here obviously will require some interpretation by U.S. Treasury, and the plan before you today takes the available language into consideration pending further details. Governor Lamont's vision for this significant infusion of resources in the state of Connecticut focuses on making a transformative, equitable, and healthy recovery for our state. And there are essentially 5 pillars to this plan. First, consistent with the governor's budget address, defeating COVID-19 is of primary importance because at this point, without doing so, nothing else matters. We have to put this pandemic behind us. And so he does this by addressing the public health impacts of COVID-19 so families can thrive. 2, investing in our future. That is reflected in his plan through upgrades and investments in our cities and towns, through infrastructure, expanded home visiting, modernizing how our residents access benefits, and continued support for broadband expansion. Our private providers are also a portion of the governor's plan, as well as how we provide additional criminal justice supports throughout the system. The third pillar is creating a more affordable Connecticut, starting with the lens of the youngest members of our society. The governor focuses on early childhood needs that have resulted from the pandemic, as well as the entire K-12 spectrum in our elementary and secondary education system, along with our higher education system and the needs of students and families during this time. This also delves into the mental health impacts of COVID-19. Fourth, an economic growth that works for all. The governor's proposal addresses the economic impacts by focusing on restoring jobs, rebuilding our economy, and returning to growth. Heavy investment in workforce development needs. And finally, in terms of modernizing state government, we learned throughout this pandemic the critical importance of continuing to invest in systems so that when residents have needs, they can access the benefits that we are investing in the most efficient manner. So continued focus on modernizing our infrastructure and modernizing our data systems to support effectively navigating a pandemic. I must emphasize that equity is at the heart of Connecticut's strategic investments for the ARPA funds, and each policy area that we will go through has been evaluated through an equity lens. The pandemic has had a disproportionate impact on our most vulnerable residents, minorities, and particularly women of color. who've held high-risk essential positions. They're on the front line, and they've felt the impacts of COVID-19, whether it's financially or in their homes or with their children. And so every initiative has been designed with equity at its core, and how we can utilize these funds in a transformative way to ensure we have programming that will be most effective, particularly for our vulnerable populations. One example includes the expansion of the Universal Home Visits program for Connecticut families to ensure that we have support in the homes for our most youngest children in society beginning at birth. Capital investments throughout this plan focus on prioritizing low-income residents and communities. Investments in broadband to close the digital divide to ensure that all families can access education supports, employment supports, telehealth. All of these areas, it was very clear we struggled with ensuring access to all members of our society because of the need to invest in broadband. Our small business initiative prioritizes funding for minority, women-owned, individuals with disabilities, and veteran-owned businesses. We propose to invest in the public health crisis, again, putting resources in the communities that have been disproportionately impacted. The governor proposes expanding the Office of Health Equity, modernizing our systems, continued supports in higher education, and throughout our entire spectrum, from the youngest of our society all the way up to the most senior. Connecticut's investments that have come through the ARPA are well over $6 billion. Some of these investments come directly to the state for allocation, and as you can see on the top portion of this table, over $3.3 billion is directly coming to the state government to provide transformative investments throughout the state. Our plan will focus on the braiding of these resources to be most impactful throughout our state. The State Fiscal Relief Fund totals $2.6 billion, along with the Capital Projects Fund, which totals $141.5 million. We have put together a complement of programs that also draws upon education funding that goes to the State Department of Education and various childcare grants and stabilization funds that would go to our Office of Early Childhood, as well as mental health and substance abuse grants that would be provided to the Department of Mental Health and Addiction Services. I would be remiss to not mention $1.6 billion of funding that will go to our local municipalities for their investment, as well as close to $1 billion to our school districts to support the recovery of our students and their educational experience. And so throughout this presentation, you will hear of opportunities for the districts and the municipalities to partner in the governor's vision towards transforming and recovering stronger. An overview of the $2.6 billion in state fiscal recovery funds. The plan that the governor will submit today, according to the state law, does require us to focus in on recommending an allocation plan for the $2.6 billion. And as you can see here on this slide, the funding has been allocated according to major policy areas. First, as a reminder, the governor's budget did include an assumption that $1.75 billion of the anticipated federal relief would be used to help balance the budget over the upcoming biennium, and therefore his plan consistently allocates those or reserves those funds under the government services line item. After allocating the $1.75 billion for our supporting the existing state operations in the general fund, that leaves about $897.5 million remaining towards policy areas. And as you can see, we propose a $15 million investment in criminal justice, $10.8 million in early childhood. This is combined with over $300 million of direct funds that are going to OEC. $161 million in economic recovery, $96 million for higher education, $22 million for K-12, coupled with close to $50 million in admin funds that will go to the Department of Education, $31 million for mental health, $50 million for our private providers, over $90 million of investments in public health, a small reserve of $25 million, state operations to continue our pandemic response and to support our employees, $50 million, our testing program, and workforce development. Let's talk a little bit more about what this means in terms of the policies. In the next two slides, we will spend less time on the numbers. We can get back to that. Let's talk about how these investments will be meaningful for the state of Connecticut. So first, starting with our youngest and most vulnerable portion of our society. First, the governor focuses on early childhood supports and making early investments in our youth to help strengthen Connecticut families. Research shows that when you make investments early, it actually saves in the long run in terms of supports that you can avoid needing if we can provide meet the needs of the families earlier on. So first, the governor proposes to provide relief to over 17,000 lower and middle income children and their families by covering the cost for parent fees through December of 2021. The governor also proposes to provide free summer school, summer preschool for 3- and 4-year-old children in our state funded centers. So essentially the families would incur no fees to continue their children during the summer, where financial challenges might have warranted have that parent pulling their child out during the summer. The governor's putting the resources in place to ensure that the kids can continue with kindergarten readiness programs. Many of the children missed the preschool experience due to COVID-19. Governor proposes to expand Care for Kids access, to temporarily expand to families earning up to 65% of the state median income, granting access to families of 5,000 additional children. We know that the child care industry has been significantly impacted by the pandemic, but families need access to child care in order to return to the workforce. And that leads us into our workforce development, early childhood services. We are going to temporarily open up Care for Kids to families that are enrolled in higher education and workforce programs. This will support up to 6,500 children to ensure that access to childcare is not a barrier to their parents participating in our workforce development programs. We also propose to expand Smart Start, offering an additional 900 public preschool spaces at free or very low cost to families, again, focused on helping parents re-enter the workforce. And finally, we propose quality enhancement supports, enhanced payments for centers that are NIAC accredited or AFCC accredited. Again, an incentive for facilities and providers to improve their level of accreditation, which will result in a more quality experience for our young children, helping to prepare them for school and kindergarten and on success. Our providers also need stability support. We're going to support early childhood infrastructure. 4,000 licensed early childhood programs serve more than 200,000 children. They need help to sustain supply as their revenues have been impacted. A critical component of the governor's plan is to provide universal home visiting for Connecticut's families, to introduce home visiting in areas that have suffered disproportionate impact, stress or child trauma, and to ensure that supports are in the home early on. And finally, to supplement our existing home visiting programs for at-risk families, and just to provide additional resources to ensure that resources are out in the community. We do need to build on the capacity that we currently have to meet needs throughout the state. And as we shift from our youngest children in the state and we move on to kindergarten through 12, obviously many are aware that the elementary and secondary education relief funds, over $1 billion going to our local school districts, will focus significantly on learning loss recovery, providing social and mental health supports, everything that's necessary to prepare our children for success as they return to school full-time in person. And so the governor believes that we need to bridge some of these supports immediately. First, the governor proposes to offer a summer camp scholarship program by allowing children to access sports or specialty camps on a reimbursement basis. The goal here is to ensure that kids who have been isolated through either a hybrid or in-person learning experience or limited in person have an opportunity to re-engage with their peers, to get them out of being in the home and back into an environment where they can thrive and experience some enrichment and prepare them to transition back to continued full-time in-person learning. The governor also proposes to provide free access for children at various attractions in Connecticut through Labor Day, including Mystic and Norwalk Aquariums, the Connecticut Science Center, Mystic Seaport, and the Beardsley Zoo. Again, we want to ensure that finances are not an impediment towards a parent taking their 2 or 3 children to the aquarium to gain an enrichment experience. Again, to build upon what they might have missed out on in school. The governor wants to provide broad access. So we have 5 agreements in place with venues, and we'll be looking to expand to other cultural and museum organizations throughout the state. For our teens, many teens, once they hit 13, they're not participating in a summer camp program, but we recognize that they too need a safe, fun, and healing space for recovering from the past year. And so we're providing resources to support teen programming throughout the state. We also recommend recruiting and training 500 college students statewide to work as mentors for children in summer programs, again, to get the kids re-engaged in the community and supporting our summer camp experience. And finally, additional expansion innovation grants for summer enrichment to ensure that children throughout the state have considerable opportunities. As we shift from our K-12 into higher education, we recognize that our families may have been impacted economically or financially by the COVID pandemic, whether it's through reduced hours on the job or they're fully unemployed. Governor proposes funding additional Roberta Willis needs-based scholarships to, again, provide additional scholarship resources to remove the financial barrier to education. Governor also proposes to enhance retention at the community colleges to support the Guided Pathways advisory model to provide direct support to those children that have greater likelihood to drop out of college or certificate programs. This funding would also include supports for emergency need-based assistance scholarships. The governor proposes doubling support for PACT, the last dollar financial aid, to support thousands of additional children over the coming years. Our institutions of higher ed have also felt the financial brunt of the pandemic through enrollment declines or reductions in meal plan or housing revenues associated with families feeling safer, obviously staying at home and participating in a remote fashion or delaying their education. The governor proposes supports throughout UConn, our CSU system, our community college system, to help them stabilize as they recover and return to full enrollment. And similarly for UConn Health Center, who's experienced reductions in revenues due to impacted clinical operations during the pandemic. There has been national news and certainly codified here in Connecticut about the impact of the pandemic on the adult mental health system, and that the needs throughout our community have increased. The governor proposes to respond in his plan first by expanding access to mobile crisis response to support the phase-in of 24 access to mobile crisis statewide. Secondly, to fund a diversion center, a regional crisis stabilization center, to reduce the use of emergency departments and inpatient care. We need additional resources throughout the system. Third, to support hospital discharges. Sometimes there's capacity, but there's bottleneck in helping to get individuals to the resources that we have available. So the governor proposes funds to enhance utilization management, to support moving individuals throughout the system to get to the resources they need, as well as scaling up our media campaigns. Now more than ever, is there a great importance to amplify our messaging to let our residents know of the available resources throughout the state to support them during this very difficult time. The governor also proposes to implement a peer support model in our 12 hospitals that have the greatest mental health needs. The peer support, again, would help to transition individuals into community-based settings or other support models to help transition them from the emergency department into resources within the community. And finally, the last component is related to workforce development to help modernize some of our state job specifications and to renew the workforce. We really do need to stimulate greater resources of professionals in this field to meet the needs throughout Connecticut. As we look at our providers of the mental health system, it's also important to expand the racial equity and social justice lens to really look at the lifespan system of care and the extent to which all members of our society can access care and have optimal outcomes. And so the governor supports resources in evaluating the tools that we're providing, the providers that we're working with, and ensuring that we are having equitable outcomes for all members of society. Devices for our DEMAS clients, we learned throughout the pandemic the importance of telehealth, and our clients indicate they like accessing services remotely. And so we believe that we should provide additional support to ensure that they can do so. And finally, we recommend supporting a pilot for access to psychiatric consultation for primary care providers so that in your primary care office, if they need to immediately tap a resource to give guidance on how to provide services to a patient immediately so that individual doesn't have to navigate on their own, we'd like to provide that linkage to get to services faster. And then as we stay in the mental health space, our children have additional needs. We had challenges prior to the pandemic with significant use of emergency department for meeting children's mental health needs, and that certainly has been exacerbated. First, we recommend expanding capacity to provide pediatric inpatient psychiatric services. So this would be a 10% rate add-on for those providers that expand their bed capacity while also achieving quality goals. Second, we want to provide supports to help achieve safe and timely discharges. Acute levels of care. If you're not on mute, I kindly ask you to please mute. We propose expanding access to emergency mobile psychiatric services. There are anticipated additional FMAP or Medicaid reimbursement to support this in the out years. We believe that additional behavioral health urgent care centers are necessary at 1 to 2 sites to divert children in the middle of the night if a parent has a critical need and they feel their only option is an emergency department, that we have centers throughout the state that can provide them with some direct care in lieu of the emergency department. Many of our children have experienced urban trauma or violence and racism, and we recognize that there are specific intervention models that can be successful in dealing with these types of challenges. And so resources are provided to support continued study as well as documentation of evidence showing the success of utilizing these models with our children. They tend to be children, minority children, and we believe that there are other intervention strategies that can be used to help our children heal from those experiences. And now is the time to make an investment to support that model and help to infuse that throughout the system. Continued integration of primary care, similar to what we discussed on the adult mental health side. Workforce development, again, in the area, we need to continue to support expansion. We need more individuals that are in this particular field because the demand is certainly and sometimes exceeding the need. We will continue to look at our programs through the racial equity and justice lens, again, a full systems review and focused on quality outcomes for all members of society. And finally, how residents access our systems and our benefits needs to be streamlined and digitized to improve the experience. Public health is at the core of the governor's plan. First, Connecticut has had a nationally recognized COVID testing program. In fact, this is one of the most significant investments that have been made over $400 million for approximately 1 year to support our our testing program, whether that's our broad community testing program and our nursing homes, our assisted living facilities, our direct care providers. And we do believe that there's a need to continue supports. The funding plan includes $240 million for COVID testing. We will monitor the need for the frequency of testing or the demand for testing as we continue to monitor vaccine rollout. The plan includes funding to continue that we remain prepared from a PPE and a supplies perspective. Many of our family caregivers have also felt the impact of the pandemic, where their elderly parents or close family members with a disability would have otherwise gone to a day program, but they could not do so due to the COVID protocols. And these families need care themselves, the family caregivers, and we recommend $3 million of respite care for family caregivers to support them with recovering from the pandemic. Our local health departments have been on the front line supporting each and every one of our districts, and they have received considerable funding through direct grants through the Department of Public Health that have been passed through from the federal government, well over $40 million. The governor is proposing an additional $10 million in the allocation plan to supplement the direct funds from the federal government. Building off of the supports that we recommend in early childhood, universal home visiting, recognizing the importance of having individuals that are on the ground understanding the needs of our residents throughout the state. The governor proposes a new community health worker or Navigator program that would provide up to 100 trusted community health workers for the 3,000 highest risk families throughout the state, to ensure that we have community health workers that are working directly with these families to tap into the benefits and the programs that they need, whether it's making sure they're aware of a workforce development opportunity or the early child care opportunities to health or benefit programs throughout the state. We recognize the importance of being strategic and targeted in those areas that have the highest risk families, and we propose piloting a community health worker Navigator program. And we've spoken about the MyCT Digital One Stop again, streamlining how residents access our social safety network. Our deaf community, the governor is recommending additional supports to ensure that individuals who are deaf, hard of hearing, or deaf-blind have the resources they need, whether it's clear masks or also support for the American School for the Deaf to continue to follow the COVID protocols, as well as to help withstand some of the economic impacts of the pandemic. Governor also proposes to improve access to contraceptive services, to invest in a time-limited contraceptive initiative to bolster our state's commitment to children and health equity. It's critical, and the federal government has set this mandate, and Connecticut is fully responding to that charge, but to modernize our data collection and DPH infrastructure. We need to eliminate our paper-based reporting, scale up, and modernize how we collect data. Data allowed us to respond in a timely fashion. We want to strengthen those systems coming out of the pandemic. The Department of Public Health currently has an Office of Health Equity. We propose to expand the office to provide 2 additional staff to really focus in on the racial disparities in public health. Our nursing home direct care employees have been on the front line. The governor has previously provided a $500 bonus to the direct care nursing home employees. The governor proposes an additional $12.5 million to support a second bonus or hazard pay premium, if you will, of $500. So the combined total would be approximately $1,000, again, in recognition of their tireless efforts to support our most vulnerable residents. And in the area of criminal justice, we have, during the temporary closures, we have accumulated a criminal case backlog. Funds are recommended to contract with temporary public defenders and prosecutors to help resolve some of the accumulated cases. We support the pretrial population by providing additional treatment services to help reduce recidivism, continued pressures primarily in our urban centers surrounding community gun violence that increased during the pandemic. The governor proposes funding to support evidence-based strategies to respond to the community gun violence. And then finally, supporting our at-risk youth and justice-involved adults with skills to meet the state's workforce needs. Part of our workforce development program will focus in on our at-risk youth or justice-involved adults as proposed. In judicial, we support technology investments to upgrade systems. Again, to support, we have rolled out more electronic tools throughout our court system, and there are needs to build upon those investments. Centralized video security monitoring, for example, in the courthouses. We propose to expand capacity for services, improving bail services capabilities, expanding housing capability through the Department of Housing and the Department of Correction contracts, supporting residential treatment collaboratives. We also recommend providing funding to reduce families' court involvement, to expand some of our contracted services to mitigate the need for families to be involved with the court system. That can occur through supervised visitation, along with other behavioral health or parenting support services. We recognize that there is likely to be an increased need for foreclosure mediation expansion, wanting to ensure that residents have access to counsel in the event that their properties are facing foreclosure after the lifting of the moratorium. And finally, additional supports in judicial to support their remote access booths. Our private providers have been a significant part of our response system throughout the pandemic. The governor includes $50 million in funding to help stabilize the operations, to support revenue losses, and any other direct COVID-related expenditures. And so as we've shifted from our youngest to our elementary and secondary education, to our higher ed system, to our public health, supports for mental health, criminal justice, and judicial, one of the critical components of the governor's plan is our economic development action plan. The governor proposes a hybrid of funding at well over $800 million to support significant investments in economic development. First, targeted small business support. This would provide matching funds to support our small businesses, creating or retaining 14,000 jobs via loans and grants. Focus of these dollars, at least 50%, will target underrepresented business owners. So we need to provide resources in the community to support small businesses. The Innovation Corridor would seed 3 transformational placemaking projects that would drive job opportunities, innovation, and business formation in our cities. The Connecticut Communities Challenge to spur investment in our main streets and to retain as well as increase the vibrancy of our communities through transit-oriented development. The hospitality industry was significantly impacted in the pandemic, and the governor proposes to provide supports, one, to strengthen the brand, to reopen the tourism industry with a marketing campaign to drive growth, as well as to provide business supports to the hospitality industry and to modernize the regulatory process. So how we license, what you have to go through to license here in the state of Connecticut. We want Connecticut to be business friendly and open to new businesses. The Green Tech Investment Fund would be a combination of public and private matching funds to invest in emerging companies that specialize in renewable energy, clean tech, and sustainability, estimated to create 2,000 jobs while advancing Connecticut. Smart manufacturing is another area of focus, as well as our Job CT program, again, creating 19,000 jobs over Connecticut. Broadband for all, significant support, as you'll hear in our capital projects plan. The focus here is that as Connecticut recovers, it's clear that an investment needs to be made to ensure that our businesses can survive, that they can grow, and that all members of society can access development opportunities throughout our state. Governor also proposes support to the Unemployment Insurance Fund, $50 million to reduce the amount that will have to be repaid to the federal government. In the Department of Labor, unemployment supports to continue the contact center and to ensure that residents' needs are being responded to in a timely fashion. Support to our arts and cultural organizations. Many of these organizations have been operating at reduced capacity and may continue to do so, or as confidence is built throughout the community, throughout the state, and they will need some support to stabilize. The CRDA, economic support, again, revenue losses due to reduced capacity. And again, critically for individuals, food insecurity was increased throughout the pandemic, and we recognize that need has not gone away. The governor proposes additional resources for grants to our food pantries and our food banks to help those that have been impacted by the pandemic. In the area of tenant eviction, the governor proposes additional legal representation supports as previously mentioned. And finally, economic development and workforce go hand in hand. We need to provide additional investment throughout the state in sector-based training. We recognize that we have jobs that are available by Connecticut businesses here, and in some cases, a skill mismatch. Governor proposes significant investment to reskill and upskill 6,800 workers in high-demand industries in healthcare, IT, manufacturing, clean energy, nursing programs. If you're a CNA, we want to put you in a path to becoming an LPN to an RN so that you can progress in your career. For our students, Governor proposes over 14,000 high school students to be a part of our Career Pathways program to help prepare them for entering the workforce. So if you graduated and are not already on a career pathway, we want to make sure that our children have not been impacted by the pandemic in a way where they do not have a path or a vision for their future. And finally, some investments to do system redesign and support expansion of teacher certification pathways. We discussed the stabilization of the state budget, investing in our government services infrastructure that funds all of the programs that we currently rely on. And finally, the governor proposes premium pay for our frontline state employees. Well over 12,000 plus state employees came to work every day to support our corrections, our Department of Developmental Services, our mental health and addiction services, our 24/7 operations, and we recognize their tireless efforts. And the governor wants to provide premium pay to honor them for their service. The governor also reserves funds in his plan for state operational improvements to support greater efficiencies or additional state needs that might come up in managing the recovery from the pandemic. In the area of housing, the governor proposes housing stability for families with children, so no Connecticut family experiences homelessness. 6,000 Connecticut homeowners impacted by the pandemic. Funds are in place to keep their home right here in Connecticut. Governor also proposes to support very low-income households through the construction and rehabbing of 200 or more units of affordable housing, to continue the Unite CT stabilization of the rental market. The federal government has provided additional resources, so we will continue to provide the rent and utility relief funds to prevent individuals from being displaced from their home. And finally, to level the playing field in housing court, providing over 12,000 indigent defendants with legal representation in eviction proceedings. As we shift into the capital projects fund that the federal government provided, Connecticut's share of this fund is about $141.5 million. These funds are available until they're fully expended. And based on the guidance, the funds can be used to carry out projects that enable work, education, and health monitoring, including remote options in response to the public health emergency. We have not yet received guidance on these funds. The governor proposes the following investments. Over approximately $40 million for broadband, curb to home build out, public space connectivity, and to build out our GIS capacity broadband mapping. $7.5 million for the MyCT resident digital one-stop. $3 million to support our physical assets along the food chain. $7 million for health and safety barriers to housing remediation. Another $7 million for energy efficiency retrofit for affordable housing. $57.4 million in this plan supports the Economic Development Action Plan that we spoke to. And finally, a nursing home infrastructure fund. 41% to economic development, 28% to broadband. and the remainder towards food supply, one-stop resident experience of accessing health and human services, housing, and nursing home supports. So first, on the broadband curb to home build out, why is this important? Again, it's critical that all members of our society can access broadband, whether it's for work, education, or health purposes. And we recognize that even when the infrastructure is in place, there's a cost for the homeowner to access the wiring of the infrastructure. And so we propose funding to help cover those costs to make it easier for our low income residents to get connected to wired broadband. Second, in our public spaces, the governor proposes an expansion of broadband and Wi-Fi connectivity and equipment so that you can sit in your local park or your community center and experience your particular town and still have access to Wi-Fi. In order to do so, we have to build our statewide GIS capacity. We have to complete the mapping so that we can understand where our broadband resources are located and particularly identify those underserved areas that do not have broadband. And so there's work here to first assess where the infrastructure exists and where it's missing, so we can be targeted and strategic with pushing for broader build out. We discussed the MyCT Digital One-Stop food chain infrastructure support. Again, we lost some of our physical assets during the pandemic, and this will help to spur jobs, economic development, and ensure that that the infrastructure can be rebuilt. The governor proposes in investing in retrofit programs to make the 30% of homes that have health and safety barriers, so whether it's asbestos or mold. Many times there are homes that are not eligible for weatherization measures because they have asbestos and mold. And so the governor proposes investments to address the remediation, to remove those barriers so that they can access the weatherization, which will help drive down their cost for utilities. Governor also proposes additional funds for efficient energy retrofit for affordable housing. Again, the goal here to reduce energy costs, promote equity for all working from home or whether you're not working from home, where you might not be able to afford these types of retrofits for your home. Again, through an equity lens, ensuring that resources are available throughout the state with additional investments. Our economic development plan, $57 million for significant investments. And then finally, for our nursing homes. Our nursing homes have experienced significant challenges. We believe it's important to provide funds to invest in improving HVAC or room conversion or using assistive technology. Also, funds could be used to incentivize greenhouse and other small house models for those quality programs, and those programs that have strong occupancy and strong quality outcomes as well. And so with that, what you have before you is a plan that goes across policy areas, that focuses on the individuals throughout the state, from the youngest child to the school-age child to the college student who might be struggling, to those, whether you're young or more seasoned, that might have challenges with mental or behavioral health that's been exacerbated by the pandemic, and then into those that are involved in our criminal justice system that need supports, into those that need support with jobs, that need re-access to the job market through upskilling, through providing the childcare resources that would be an impediment, and that those jobs will be combined with investments in economic development throughout our state, all of which are critical components, whether it's through the lens of the individual person, through the lens of a family, through the lens of a municipality. All components are critical for a transformative, equitable, and healthy recovery for our state. And so with that, we will take any questions that you may have, and I am joined by a number of the governor's commissioners in his cabinet who will be here to answer your questions in more detail.
Thank you very much, Secretary McCaw. Once again, reporters, please use the hand raise function on Microsoft Teams to make it known you'd like to ask a question. You could also send me a text message to make it clear you'd like to ask a question. We are joined, as I let the list populate, we are joined currently by DCF Commissioner Vanessa Durantes, DECD Commissioner David Lehman, Beth Bai from the Office of Early Childhood, Miriam Delphin Rittman from the Department of Mental Health and Addiction Services, Dr. Deidre Gifford from the Department of Public Health and the Department of Social Services, and from the State Department of Education, Charlene Russell Tucker. First hand raised is Sue Haig with the Associated Press.
Thank you. Good morning, everyone. Hi, Melissa. A lot of these initiatives, they sound like things that will be needed for many, many years to come. So what happens when this funding runs out? And for a lot of these initiatives, are we to assume this is enough money for 3 years or fewer years or more years?
Sue, good to see you today. And first, the proposal that the governor put forth certainly covers all costs for a 2-year period. And some of the initiatives are indeed time limited, that there's an increased demand, if you will, for supports. For example, food insecurity. I'd like to hope that in 2 years we don't have the critical needs that we have. But there are a number of others where we believe that expanded capacity is important. So for example, in the area of children's behavioral health, we knew we had a challenge prior to the pandemic. It's been exacerbated by the pandemic, and the state needs to step up and respond. And then there are other programs where we're going to pilot them and determine their efficacy, whether it's the Universal Home Visiting Program. Some of these programs might be eligible for incorporation into our Medicaid program, so there'd be a considerable federal match on the back end. Again, this is about determining which ones are short-term in nature because of a specific need, or those that really need to become a part of our model. And if so, we'll be looking to leverage federal dollars to make that more affordable in the out years.
And a quick follow-up, how did you come up with this list? What was the process, and how much input did you have from outside groups beyond, and in addition to the commissioners?
Sue, great question. I must tell you that the governor set a vision at the outset of this process that he wanted this plan to be transformative. And therefore, we put together a team with a number of members of the governor's cabinet to think about how agencies and policies are cross-cutting, and that, when you think about a child, you have to think about it through the spectrum of, Commissioner Durantes is on, and she'll tell you that more than 50% of the kids that interact in the DCF system are age 0 to 5. They're the kids that Commissioner Bai is serving in early childhood. They're the kids that Commissioner Gifford is trying to support from a public health perspective. So we took the approach of bringing together agency leads across policy areas and having some of these recommendations informed by discussions with various stakeholder groups. Commissioner Durantes, do you care to comment a bit?
That's right, Secretary. And, many of the children's behavioral health recommendations come directly from the Children's Behavioral Health Plan. And in that, we regularly consult with stakeholders that are impacted by the recommendations that have been made.
Okay, great. Thank you. I know there's probably a lot of other questions. Thank you.
Amelia Ott with the CT Examiner.
Thanks, Max. Thank you, Secretary. I just have a couple of questions regarding the early childhood. I was curious to hear if there is anything that will be going toward either supplementing salaries or making things more attractive for childcare workers, since I know that there has been a shortage in the state, or if there's further funds going toward childcare providers that have suffered because of the pandemic.
Commissioner Bai is on the line. I'm going to let her take that one for you.
Yeah, thank you so much for that question. You've hit on a key challenge that the field faces. Programs we'll be sending out $120 million in funding, stabilization funds to childcare programs. And part of the requirement will be that at least 25% of those funds end up with staff. That is, that they could help them pay their health costs. They could give them a bonus. They can increase their wages. They can contribute to a retirement plan. But that of those funds we send out, we want to be sure the dollars get to the people doing the work who've been out there in this pandemic, many of them putting their own family members at risk during this time. And also think of those stabilization funds, 2,000 are going directly to family child care homes, about 1,800 to 2,000 And those are small businesses owned by women, predominantly women of color, who have these small businesses. So that will be funds that go directly to those providers providing the services. In addition, you heard Secretary McCaw speak about paying more for high quality care. So the governor, and this is some of the Care for Kids changes are temporary, and they say temporary in the report. The one part of Care for Kids that the Secretary and Governor thought was important to carry on beyond the pandemic was to pay higher rates from Care for Kids for programs that achieve the high quality standard, being accreditation or Head Start quality standards. And that's where the funds come in to really help those programs meeting the quality standards be able to improve their staff wages. So those are a couple ways we're working to get the funds to the folks, the lowest paid profession in the state of Connecticut, who've been on the front lines. And Governor Lamont is recognizing that in both the design of the grant program and in increasing the rates in the high quality programs.
Thanks so much. And just one other question. Regarding the respite care that you mentioned, could you say a little bit more about how that would work, who would qualify for it, what the amount they would receive would be, for how long it would last?
Sure, we'll have to do some follow-up with you offline. The state has had respite programs in the past. We expect that significant beneficiaries, if you will, of the program will be those that are supporting an elderly parent, for example, or an individual that has intellectual disabilities. And so the program has not been fully developed at this time. However, the governor wants to set vision in stating that he recognizes there's a need. Develop the program afterwards, but he recognizes that there's a need for these caregivers to recharge their battery. And it's a program that we've run in the past, and we will look at what the need is compared to the dollars that are available as approved by the legislature in the final package, and we'll develop a program accordingly.
Great. I'm sure there are other questions, so thank you.
Keith Faniff with the Connecticut Mirror.
Thanks, Max. Can you hear me, Melissa?
I can, Keith. Good morning.
Good morning. Just two questions. The first one's just kind of tech.
Keith, I believe you went on mute.
Keith, unmute if you can.
Okay, am I unmuted?
Yes, sorry about that. Not sure what happened.
Okay, no problem. The first question was on slide 7. You give a breakdown of all of the money coming to Connecticut, the direct money to state government, flexible and not flexible, and the other tranches. I thought there was one specifically for higher ed, and I didn't see it in that list. Am I mistaken?
You are not mistaken. The higher ed institutions have received a third round of the higher education emergency relief fund, which will certainly support them. I believe it's well over $100 million in the third round. As we experienced with rounds 1 and 2, those dollars were not adequate to make up for their enrollment losses and students not living on campus. So they will have a third round. We provided some minimal additional support in the event that their enrollment doesn't get to where they need it to be, coupled with the HERE 3 awards they've received.
And that's no problem. I just want to make sure if I'm reporting the full amount. So in addition to the $6.28 billion you've laid out in slide 7, there is, I want to say it was like $370 million for higher ed. That's not part of that, but it's still ARPA money.
That is correct. And there are a number of other funding sources in ARPA. We tried to focus in on those that will be directly correlated to the plan. But you are indeed correct about the additional HERE 3 funds for higher ed.
Thank you. The only other question I had is, could you talk a little bit in detail about what you'll be doing for nonprofit social service agencies?
So first, we obviously need guidance from Treasury. We are hearing from providers that they have still incurred additional expenses. So some providers indicate they've had to purchase additional vehicles because of the social distancing requirements, or the extent to which clients have not returned to day services because families are not comfortable. So the language in the bill does appear to allow the funds to be used for economic impacts or revenue losses as compared to pre-pandemic levels or COVID-related expenditures. So right now we've identified $50 million under those particular terms. Once we have guidance from Treasury and we have a sense of what the nonprofits are looking for in terms of support, we can certainly craft a package that hopefully meets their needs. $50 million is what the governor wanted to provide to get them through the next year to 2 years.
Oh, so that's 50 for the biennium.
That's correct.
Okay, thank you.
Thank you, Keith. We'll go next to Paul Hughes with the Waterbury Republican American.
Thanks very much. Just a real quick question on the spending cap. How is this money counted towards the spending cap? Is it possible that it could be moved off?
We do not believe that it will impact the spending cap. For example, the coronavirus relief funds were not appropriated. They were not recognized as federal revenue. We expect that we would certainly the portions of this program that are grant and discretionary in nature likely to be run in that similar fashion. But obviously, we're going to begin discussions with the legislature on the budget and how to fold this in. But we do not expect to have any spending cap implications.
So would the 1.75 billion that you counted on, that's not going to be counted towards the cap calculation?
We are expecting that to be recognized as revenue replacement in our revenue schedule, but absolutely need clarity from U.S. Treasury on the rules for revenue replacement. You'll notice in one of my earlier slides that there's language in there that it cannot be used for policy changes that impact tax revenue. So there's a lot of nuance there that makes some of that unclear. So I'm going to hold on answering that question until we receive Treasury guidance. We're hoping to receive that in the coming weeks.
Okay, and then I know there's a movement, a sort of afoot in Waterbury to seek some funding for prisoner reentry programs. How would they fit into any of the programs or allocations, proposed allocations that you just outlined?
So there are resources for criminal justice supports. There nothing specific, if you will, to reentry, but certainly as long as we can make a connection back to the impacts in that population as a result of the COVID pandemic, that will be key. And that's one thing that's important to emphasize as we seek to finalize this plan with the legislature is there has to be a connection back to the impact of the pandemic on these particular populations. So the extent to which there are desires to think about a reentry component, we'll look at it through that lens. There are some investments in here, and we expect that some of the areas of priority could change as we hear from our colleagues in the legislature as well.
Okay, thank you very much.
Chris Keating with the Hartford Courant.
Thanks, Max. Melissa, can you tell us a little bit about the scope of this? I mean, from what you've outlined here, the scope seems rather gigantic. What I'm asking about on that is, does this cover, for example, I don't know, 25 different departments? I mean, you mentioned the judicial branch, you got the executive branch involved. The scope seems rather large, and I don't have my arms around how big the scope is.
Sure. So Keith, it's anywhere from 10 to 15 agencies could be involved depending on the policy area. Not in any way different than how we invested the coronavirus relief funds, depending on the demand, whether it was testing. Testing was across the comptroller's office, social services, and public health. We essentially invested in almost every state agency to get through the pandemic with the CRF dollars. These dollars are probably less broad, but certainly will require the coordination between over 10 to 15 state agencies to implement these programs.
Okay, and also is any in the legislative branch? I mean, that just popped in my head. I know you mentioned judicial branch. Is there any money going to the legislative branch? I obviously it's a smaller branch.
Well, there is no funding going directly to the legislative branch, but I believe that what we need to be thinking about are the mutual priorities. And we have had our ear to the ground on discussions during the appropriations process, as well as in the various committees of cognizance, to hear of the needs that are emerging through those discussions. And we believe that a number of the areas here reflect desires or needs that came through that process or that might be reflected in the appropriations budget. And then we'll begin to have discussions about where revisions are needed to meet both the governor's as well as the legislative branch's needs. So their dollars are in every single area, as are the governor's dollars, and that's investing in these programs, investing in people, and helping them to successfully recover.
And also, since this has to go through the legislature, do you view this as basically almost running on a parallel track with the budget? In other words, this has got to go through the House, the Senate, it's got to be negotiated. Do you view it as a separate, maybe there's crossover, but do you view it as a parallel track with the budget?
I do. Certainly, we can't lock down a budget that has assumptions surrounding revenue replacement or use of federal dollars without tying it to this plan. If that number goes up, if the amount that we're relying on out of the ARPA dollars goes up for budget balancing, then that means there have to be cut to other programs. I do believe that the legislature will be looking to address some of their priorities through these funds, as they should. This is a significant amount of resources, a one-time, in many decades experience for the states, and we should jointly be looking to partner on what we think will be transformative investments that, 2 to 3 years after this, we need to see the ROI in people's lives and in the state's overall economic recovery.
Okay.
Jody Latina from News 8.
Good morning, good afternoon. Will the presentation live somewhere so we can refer back to it? And then the real question, there are some provisions that some cities will be getting some extra funding because we don't have county government, and that was the way the Congress made their legislation. Can you talk about that a little bit?
Sure, Jody. Good to hear you this morning. Yes, the presentation and the full report will be available. It might already be right now. It's around 12 noon, or at least by the time we conclude this presentation, it will be available on the governor's website as well as the Office of Policy and Management's website. With respect to the funding that will be coming to the local municipalities, there's a one portion that was entitlement and one non-entitlement, one based on county and requiring a redistribution. In any event, the total funding is about $1.56 billion. And the municipalities, too, are waiting for clarity on how these funds can be used. They have the same guidance that we've received for the state fiscal recovery funds. The governor's vision that he's setting today these are the critical tenets to Connecticut's successful recovery, whether it's early childhood, workforce development, economic development in our cities and towns, or supporting mental health needs throughout the state. And he is encouraging our local municipalities, when they receive their dollars, to leverage and partner. Great example. The governor's supports for free summer camps for families below a certain income level. That's a almost $14-15 million investment. It could help 24,000 kids. Well, if that municipality can match that investment, 50,000 kids in the state of Connecticut could access a camp program that otherwise they wouldn't. They'd be home, sitting with grandma or whomever, or their neighbor, and they need to be back out in the community, interacting with their peers and receiving enrichment. So we see these planning processes coming together. The governor's setting vision today, and he's looking for our leaders throughout the state to step up and link arms and partner with him in these policy areas.
Thank you. I appreciate that.
All right, there are no more questions. I want to thank everyone for participating in this press conference today. If you have any follow-ups, you can reach out to Governor's office, myself, or the Office of Policy and Management, Chris McClure. Also, if you have agency-specific questions, you can reach out to the specific agencies, or we can point you in the right direction. Thank you very much, everybody.